been labelled a cruel and unnecessary blow to Tasmania's most vulnerable. The likely closure of a specialised dementia unit at the Royal Hobart Hospital has advocates up in arms. Support organisations say the move doesn't make sense, with Tasmania having the oldest population in the country.
Mary Newman knows only too well of the need for specialised dementia care in Tasmania. She spent the past 7 years looking after her husband Fred, who only recently passed away.
It really becomes almost impossible to cope.
Her husband almost reverted to childlike behaviours and relied on Mrs Newman for everything. A visit to hospital was one of the most distressing experiences for both of them.
It is a terrifying experience for them. Once they're taken out of a situation where they feel comfortable, they just don't know what to do.
Mrs Newman says the opening of the specialised Nell Williams ward at the Royal Hobart Hospital was a blessing. She's devastated it could soon be closed because of state government budget cuts. While a hospital spokeswoman says no decision has been made, an email sent to hospital staff last week says the emergency short stay unit will be relocated into the Nell Williams unit from this Wednesday.
In truth, it makes me very angry. That is one of the few things that have been done for these people, and to take it away, I think is really quite cruel.
And with the increased number of people with memory loss projected for the next 10, 15 years, we're going to need more of these things, not less.
On average, 1 in 5 Tasmanians are diagnosed each week.
Governments are talking about the challenge of dementia and the increasing people suffering dementia, but there's not a lot of investment and a practical approach on the ground.
We do have a number of people who have contacted us talking about this wonderful service that we offer in Tasmania, which is going to be taken away.
An internationally award-winning concept no longer. Anna Yard, ABC News.
North West mental health workers have been told 13 frontline jobs are to go. Staff were today briefed on the cuts, which will include nurses, social workers and psychologists.